historically, when money and power are able to operate without public accountability, they steal all the money. The role of the journalist in America is to harass money and power to no end every day, day after day, on behalf of the American taxpayer.
MSNBC, the place for politics.
Welcome back. I'm David Schuster, live in Washington.
And I'm Tamron Hall, live in New York. So, David, it is time for the face-off of the day. And today we learn Minnesota Governor Tim Pawlenty may invoke the 10th Amendment to the U.S. Constitution as a means of trying to block federal health care reform.
That's right. Responding to a caller who asked him about it on a Republican governor's conference call last night, here's what Governor Pawlenty said. Quote, depending on what the federal government comes out with here, asserting the 10th Amendment might be a viable option. We can't really even get the president to outline what he does or doesn't support in any detail, so we'll have to see. I'd say that's a possibility. If you're a little rusty on the Constitution, here is what the 10th Amendment says. Quote, the powers not delegated to the United States by the Constitution nor prohibited by it to the states are reserved to the states respectively or to the people. The one little problem with the argument from the Tenthers, as they like to call it, is this other part of the Constitution that's called Article 1, Article 1, quote, the Congress shall have power to lay and collect taxes, to pay the debts, and provide for the common defense and general welfare of the United States. That means it unambiguously authorizes Congress to spend money in ways that benefit the nation. Social Security, Medicare, Veterans Care, et cetera, et cetera. So what are the Tenthers really up to? Here to face off are Democratic strategist Karen Finney and Republican strategist Ron Christie. Ron, most people in their right-thinking mind know that the 10th Amendment is a bunch of baloney. So what is Tim Pawlenty going for politically here? Is he simply trying to appeal to the right-wing fringe and get ready for a run in 2012?
David, right-wing, fringe, Republican. Look, actually, David, I agree with you. As a lawyer, if you look at Article 1, the General Welfare Clause, to me, seems very explicit on its face that Congress does have the ability to regulate in several areas, to lay taxes, obviously, is one. And it would seem to me, looking at Medicare, Medicaid, the United States government has spent trillions of dollars in healthcare-related expenses. So I think Governor Pawlenty is appealing to those who are very disgruntled by what President Obama is doing. But as a lawyer and one who's observing this, I think that they're on the wrong foot here.
Wow. Is it wise, though, and I guess this is a pure political question, is it wise politically for him to try to make his appeal to the right with this?
I don't think so, David. I think, again, you can take issue and exception with this administration on a wide variety of issues, but going to the 10th Amendment and saying that these powers are not specifically delegated to the federal government and therefore it should be a state issue, I think falls flat on its face. It doesn't make sense to me.
So, Karen, with a desperate move like this, then you would think that this would be called a great week for the Democrats and they can move forward in this. And those moderate Democrats, I don't know, everybody just come on home and hug one another and come up with something to put on the table here.
Well, I just want to point out that this is a momentous occasion that actually Ron and I agree on something. Wow. This has never happened before.
Special music for
breaking
that.
news on MSNBC.
Wow.
I just couldn't let that pass.
Right.
Look, I think part of what the Democrats need to continue to do is to point to these kinds of ridiculous ideas. Essentially saying you're going to use the Constitution of the United States of America to actually take away choice from people in the state of Minnesota in terms of their health care is pretty ridiculous. So certainly, but I think the Democrats could be doing a far better job, and I think the president actually started us on that path on Wednesday in pointing out just a number, or any number, of these outlandish, ridiculous comments and these kinds of proposals that the Republicans are putting forward. Essentially, part of the whole argument that you've heard from Republicans in terms of their opposition to the public option is that, it's not fair. Well, when has the Republican Party ever been opposed to competition in the marketplace? That's sort of a fundamental tenet of capitalism. So they're essentially saying we should just trust the insurance companies the way we were to trust the big banks on Wall Street. But again, I think it's for Democrats to be a little harder and tougher in making those points and pointing that out.
Ron, your view.
Well, my view, again, I think if we want to have a more vigorous and spirited debate on health care, that's something I think Karen and I would disagree on. I think the Republicans have actually put forth a number of vigorous ideas. H.R. 3400 that was sponsored and introduced by Congressman Tom Price from Georgia, the chairman of the Republican Study Committee. There are a number of good ideas in that. One of the things I think that would help get a number of people on the health care rolls is the ability to buy insurance across state lines. I think that's a very smart idea. If you look at the bills that have been introduced in the Senate by Senator Bennet Bennet and Ron Wyden. I don't necessarily agree with those tenets, but there are a number of bipartisan pieces of legislation addressing the health issue. But I think the commonality that Republicans say is the public option is not a good option. It's something that's going to bankrupt this country. But there are many, many other viable alternatives that we can do to make sure to get people who don't have health insurance coverage, Karen, onto the rolls. That's a very important distinction.
But again, as the president made clear on Wednesday night, his proposals would incorporate a number of Republican ideas, and I think the Democrats and the president in particular has always been open to incorporating Republican ideas. But when you look at things like what Tim Pawlenty said, it becomes once again very clear that the Republican agenda has nothing to do with ensuring quality, affordable health care for Americans. It has to do with a political agenda in trying to damage this president politically and make political gains in 2010.
Let me say this. Let me say it for the last time. Where is the president's plan? The president talks about his plan. There has not been one specific piece of legislation that has been released by the White House that lays out in a very clear, articulate manner, this is what President Obama's for, this is where he's going to draw the line.
Actually,
he's allowed
for Congress to draft legislation,
but that's weak. I mean, I spent 4 years in the Bush administration.
That actually happens to be the way it works.
No, it's not, Karen. I don't know if you've ever worked in the White House. I have.
Actually, I have a longer period than you did.
President Bush actually outlined for his tax cut, for his No Child Left Behind, and his various pieces of legislation to the Hill. Here's my document. Congress, here's what I expect. President Obama has advocated his leadership in this area, and I think it's a mistake.
Wrong. Republicans have abdicated their leadership by whining and hiding behind the idea that, well, Democrats control everything and we can't get anything done, rather than stepping up to the plate with serious ideas. President Obama put forward a serious...
We're going to wrap it there, but I think we can clearly say the one person who has abdicated maybe his judgment is Tim Pawlenty. For him to try to go to the right on this crazy 10th Amendment stuff is really, really unbelievable. But in any case, Karen Finney and Ron Christie, thank you so much. We appreciate it. And Tamara, what do you think drives people to come up with this wacky 10th Amendment thing, which is it's just not true?
David,
you can't
we've been
use
asking that question about the birthers, the truthers, the deathers. I mean, usually anything that ends with an I don't know. I'm not a member. I'm baffled as well. But I was fascinated, though. Speaking of crazy, there was a conversation on Morning Joe, and Governor Pawlenty had a difficult time admitting that the death panels were not true. So it seems he's got a strategy, and I think it was Mike Barnacle who said there must be some polling that shows that the far right, they're getting traction on this, and that's why we can continue to see this. But I guess the general rule is be careful of anything that's birther, deather, truther. Could get you in trouble. Up next on The Big Picture, though, it has been, of course...
Healthcare reformers would have you believe they want to keep you healthy, but nothing could be further from the truth. Their plan to make your health coverage affordable is nothing but an attempt to sell your organs to the highest bidder in China. Though their reforms will foster competition among insurers, their real plan is to use unnecessary medical procedures to turn Sarah Palin into an unattractive man who would kill Todd. Sure, reform would prohibit companies from denying you coverage, but that really means President Obama will personally slay your elderly grandparents and mercilessly drown this innocent puppy.
You gotta tell them, silent breed is people!
Their plan is to make Medicare more cost-effective, yet that will lead to swine sex marriage and Kenyan citizenship for all. Stop this reform madness now, before Obama sneaks into your bedroom and feeds Nancy Pelosi your still beating heart. Paid for by Americans for Insurance and Drug Company Prosperity, who enjoy paying more and getting less.